Okay, so today's our two important breathings sharing are Kapalbhati and Bhastrika. Scientifically, they are known as high frequency breathings. Kapalbhati is a Kriya according to yogic text. What is Kriya? Kriya is something which is cleansing technique, and Bhastrika is a pranayama. Pranayama is something that helps to extend or expand the dimensions of the breath or the prana. So I have prepared some important information because they are different from the other type of pranayamas and breathings. So we have to look at the important information carefully before we commence the practice. So Kapalbhati. Kapalbhati is having two word here, Kapal and Bhati. So you can see Kapal means cranium or forehead or the frontal lobe of the brain. Bhati means shining, light, splendor, and knowledge, perception. So Kapal Bhati is the first cleansing technique that helps to stimulate, awaken, and enhance our perception and knowledge. You would have seen most people do Kapalbhati at abdomen level. Okay, and what happens? The Kapalbhati effect did not take place. Why? Because probably their practice focus is something different. So today you will see scientifically what Kapalbhati is and how it is done in a proper order and how to drive the best effect of Kapalbhati. So before that, let me take you through the very important keynotes. As I mentioned, Kapalbhati is a Kriya cleansing technique, not a pranayama, but you can see like it is worldwide known by the name called pranayama. The force of breath should be experienced in the nasal passage, not in the throat. As I was mentioning, that most people do Kapalbhati by flapping abdomen. Okay, whereas the Kapalbhati is supposed to be done at the nasal passage. So we will see in the practical session how. The focus should be on forceful exhalation, not on the flapping of abdomen. And scientifically, it has a term called high frequency breathing. When you want to look at the research, you won't find the word Kapalbhati, but you will find the word called high frequency breathing. Three types of Kapalbhatis are there. Most people know only one of the Kapalbhati, which is done with the breath. But according to the Hatha Yoga texts, there are three different variations of Kapalbhati. The one you do is done with the breath, and two more are done with the water. So I'm not going to teach you this water one today. I will just focus on Vata Krama, the wind one. But anyways, I will just demonstrate you how these two are done. So you take water, the lukewarm saline water, take it from your nose and release from the mouth. And another one is take water from your mouth and release from nose. These are advanced Kapalbhati, which are not generally taught. Okay, but our today's practice is Vata Krama Kapalbhati, which is done with the breath. So the Kapalbhati, as I mentioned, is high frequency breathing, which means normally we breathe about 15 to 16 per minute. But if Kapalbhati takes us to the next level, means around 40 to 120 breath per minute. Okay, that is the frequency of the breath. So here the beginner should not directly rush to 120 strokes per minute. The beginner should start with a very small number, let's say 40 to 60 strokes per minute. Okay, we'll see how the practical part of this. And slowly progressing in this breathing, he should take his practice further to 60 strokes per minute, 80 strokes per minute, 100 strokes per minute, 220 strokes per minute. This is the way how Kapalbhati should be progressed. So this will minimize the number of mistakes that people make, and this will train the muscles, this will train your brain, this will train your coordination of neuromuscular system, and then there will be less chances of making mistake and maximum chances of getting the benefit. 2 to 3 rounds are recommended for daily purpose, and up to 5 rounds can be practiced. But for some therapeutic purpose or some special need, the number of rounds can be adjusted. So what happens when we do Kapalbhati? According to yogic philosophy, we have some special breath or prana carrying system inside the body, nadi channel. They are purified. The whole mind get energized. That's why I call people who feel sleepy, lazy, sad, depressed, low in energy, lethargic, and low mood. They should do such kind of breathing so that there is pumping of oxygen rich blood to the brain, and the brain neurons get excited and you overcome of the sadness, depression, emotions, negativity, negative emotions. Fantastic breathing to energize your mind. It removes sleepiness, best for meditation by arresting the thoughts, and of course the physiologically the lungs will be cleansed, will be helpful for asthma, allergy, tuberculosis, and bronchitis patients, and PCOD, and it strengthens the nervous system, tones your digestive system, and so many benefits of this technique are there. But most why yogis used to practice this is to get help to enter in meditative state directly, because this practice is designed in such a way that after you finish the practice, the breath ceases for a while, and that time the yoga says breath moves, mind moves, breath stops, mind stops. So they used to take help of this breath so that they can overcome of sleepiness, laziness, and they can get direct entry or quick entry into the meditative state. But having lots of benefits like stimulating metabolism, reducing weight, etc., people start looking at the benefit side and they start practicing. I would suggest you to look at limitation part also. Okay, so what are the limitations? People with heart issues, blood pressure, vertigo, epilepsy, stroke, hernia, gastric ulcer, and during menstrual cycle should avoid doing this Kapalbhati, or when you do it, please first time do it in proper guidance. Okay, so that is Kapalbhati. Now, the second technique for the day is Bhastrika. Bhastrika is not cleansing technique, it is pranayama. So Bhastrika comes from a very traditional reference we can give here is it's called bellows breath, which is similar to the bellows of a blacksmith, village blacksmith. Due to that reason, Bhastrika is called bellows breath. Okay, but how it becomes pranayama? Pranayama definition is tasmin sati swans praswans yor gati vichedaha pranayama. The breath which is extended, expanded in its dimension, in its frequency, then it becomes pranayama. So what we will see here, inhalation, exhalation are or equal length, which is different from the previous. Previous one was exhalation forcefully, inhalation passively. Here both inhalation and exhalation are forcefully. So this is the difference in these two breathings. Now preparation is done by just 10 rounds of forceful breathing following the 1:1 ratio, means equal inhalation, equal exhalation. 20 strokes can be done, and then just observe the changes. The last breath can be more strong, inhale and exhale. There are several techniques like this, so we will only practice a couple of techniques because the rest of the techniques are advanced. Then the same sequence is done following the uni nostril, left, right, and then both nostril. Then afterwards, you would have seen like people try to retain breath inside. So that is the technique 3. Once you complete 10 rounds, you inhale the last round and hold it. Okay, like that, left side, right side, both nostrils together. This is called inner retention. And then it can be also incorporated with external retention and with the bandhas, which are called the locks. But again, all the limitations are pretty similar to the Kapalbhati because they are both of the same nature, high frequency breathing. People with these conditions should avoid it, and pretty similar benefits because they are of the same nature. So now I'm taking you to the first technique, Kapalbhati. Okay, I will just stop the slide. And perfect. So the first technique, Kapalbhati. Now, why I started by highlighting those key points because it is very important. The practitioners, the people who are joining this session, I'm not aware of your condition, who has your condition, you know very well. So please make sure we follow the limitations and benefits of the technique. Don't just come in impression of benefit and start doing it. Okay, the limitations are very important. Now, the first technique, Kapalbhati. How to practice the Kapalbhati? I would like to once again remind you, Kapalbhati is active exhalation followed by passive inhalation. Active exhalation is forcefully exhale from your nose. Okay, mouth will be closed all the time. Now, I will just demonstrate how. So, your hand is on your abdomen. You just experience it, and your left hand resting on your left knee. Now, the way you blow your nose, the way you sneeze from your nose is the same kind of exhalation. Look at it. Like that. Okay. So you are exhaling forcefully, and the force of the air is experienced where inside the nasal passage. You have to avoid forceful abdominal movements. Okay, that is good, but it is mechanical, because when you force your abdomen movement, flapping abdomen, it becomes more mechanical. Okay, Kapal is here, forehead. Bhati means perception, knowledge, shining is here. How will it come by flapping your abdomen? No, it will not. When you force your exhalation, your air inside the nasal passage, we have the first cranial nerve or olfactory nerve, which are coming from the central nervous system. When you forcefully exhale from nasal passage, the sensation, the stimulation go to your brain, and then there will be sensation, stimulation inside the brain, and then the perception is enhanced, the knowledge is enhanced, and then there will be the activation of the brain. Okay, so Kapalbhati is for the forebrain, not for abdomen, not for reducing the tummy. So that becomes abdomen bhati, not Kapalbhati. Okay, so this is the thing I wanted to mention before we begin. Okay, now if you are a beginner, sit comfortably and do it slowly. Okay, look at me one more time how you can do it. Now you will be seeing that my abdomen get some movements. It is because of the forceful exhalation, and it's by effect of my forceful exhalation, the abdomen moves. But my attention is not on abdomen, my attention is at forceful exhalation. And then take time, let the inhalation take place. You do not inhale. Okay? So are you with me? You want to practice? Sit comfortably. Adap Chin Mudra, both the hands resting on your knees. We'll only do the slow frequency, which is 40 strokes a minute. Relax your body, relax your mind, and take 1 or 2 deep breaths. And take 1 more deep inhalation, and begin by forceful exhalation. Continue till 40 strokes with full attention at your nasal passage. Ensure that you are only focusing on exhalation, and its effect is in your nasal passage, not in your throat, not in your abdomen. Please focus on forceful exhalation and continue till 40 strokes. And after 40 stops, stop your practice and observe spontaneous cessation of breathing. And once your breath becomes normal, gently open your eyes. That's the magical breathing. I'm very experienced of this breathing. I have been teaching this to my so many students, participants who come for yoga therapy and also in my yoga classes. They have mentioned that Kapalbhati prepare them for whole day. Early morning, empty stomach, we do Kapalbhati. 2-3 rounds of such breathing will take care of your whole day-to-day life in order to preventing and managing the day-to-day stress, anxiety, and keeping you energized and free from any laziness and negativity. Fantastic breathing. Now, I would like to highlight here one research work, which is Nobel Prize research work by Dr. Walker. He found in his research that all the healthy cells in our body need oxygen, but unhealthy cell like cancer cell can live in without oxygen environment. He also found that if you deprive a healthy cell of oxygen for 30 to 40% in 48 hours, the healthy cell can even convert it to cancerous cell. Now it makes sense that we must do such strong breathings in our day-to-day life, at least 4 to 5 minutes, so that we can nourish all our healthy cells, we can supply plenty of oxygen to keep them healthy and preventing them from converting to unhealthy cells. Now, the second breathing is Bhastrika. Hope the Kapalbhati is clear. You may ask question later on. Now, we have to go to the second breathing called Bhastrika. Bhastrika is more than breathing. It is called Prana Ayama. Ayama means extension, expansion of the dimensions of our life force. Yogis were practicing pranayama and they were able to maintain their young mind, young thinking, and even their health, like how their teenagers healthy, they were healthy even till the age of their uh, elderly age and till the death time. And they could even prevent and they could even manage all the disease disorder by following this pranayama. So this second pranayama, the breathing technique is pranayama and very effective and little bit different from the previous one. However, both are of the same nature, high frequency breathing. So what is the difference here? Here we have active inhalation, active exhalation, active inhalation, active exhalation, and both are taking same time. Let's say you take 2 seconds to inhale, take 2 seconds to exhale, and involve your abdomen, mostly involve your abdomen in inhalation, exhalation. I will just quickly demonstrate. Look at me. Both hands resting on your knees. So I'm inhaling, expanding my abdomen. Simultaneously, I'm exhaling and contracting my abdomen. So my focus is brought at abdomen. Okay, this will train my diaphragm to move deeper and activating my inferior lobe of lung. Okay, so this is the ordinary way of doing Kapalbhati. From my understanding, this way of breathing like for pranayama, like Bhastrika, will only allow your lower lobe of lung to activate. But if you and you will miss chance to activate your middle lobe and superior lobe. So what I have understood and what I have been practicing and teaching to make this pranayama more effective and more result oriented is you start inhalation from your abdomen to your chest, to your clavicular region. Start exhalation from your clavicular region to your thoracic region to your abdomen. Let me demonstrate how. Breathing in from abdomen. Like this. So allow your entire lung to fill in completely. Allow your entire lung to get empty completely. Involve more and more your dormant lobes of your lung and release them like that. This is fantastic way. Within 10 to 20 breaths, you will feel like the sensations in your whole body, sweat in your whole body, and shivering, quivering. All these are the by effect of this Bhastrika pranayama. You don't have to worry about that. Just after 10 breaths, stop and observe changes. Okay, are you with me? Let's start. Sit comfortably, both hands on your abdomen. We do first round 10 times only. Begin. Breathe in from your abdomen to clavicular region. Breathe out in reverse order. And the last deep inhale and deep exhale and stop the practice and see what happens in your body. The whole body is energized. You can listen to your heartbeat, pulse rate, blood circulation, tingling, throbbing, pulsation, expansion, contraction, heating, cooling, sweating. So many types of sensations start arising, appearing in your body, in your breath. Listen to all and observe for a while. All the sensation will disappear in a short while. And open your eyes, you will feel more clear in your thinking and free from all that but bothering you, that tearing you, the past, making you anxious, the future, all disappeared and you are in now with yourself. The same thing is done by uni-nostril. So please close your right nostril. We'll quickly go through the second technique. Just close your right nostril and do 10 times same breathing left side. And stop the practice and observe changes. When your breath becomes normal, do the same right side. Close your left nostril, begin right side. And stop the practice. Very good. Observe changes. And the last round, both nostrils together. And observe changes. Rise, with palms, and step like rise, face, whole body.